So minimizing injury or harm associated with dangerous or risky activities is harm reduction. For example, driving can be dangerous, but seatbelt use reduces the risk of harm with this activity. At the Northwestern Health Unit, we support harm reduction methods.
The seatbelt doesn't prevent you from driving. Or for those of us who have kids, we always remind them to wear their helmets. The helmet doesn't prevent the kid from riding the bike. It's the same thing with our needle exchange program. We're not asking at this point in time for the individual to stop this behavior. We're only providing them with the means that as they engage in this behavior, the harms that's associated with using and reusing and sharing needles, we minimize that harm.
So harm reduction is often one of those programs that is deemed like the black sheep of public health, meaning that a lot of times we are dealing with people who are in severe substance use disorder. And so when we enter into a relationship or an exchange with somebody, we're really having to step it up in terms of building that relationship and taking caution with the person who's accessing, because we know that they've been victimized throughout the system. We also want to get to know them so we can build on what their positive supports might be or their protective factors might be in order to help them explore different options that might lead them along the way to recovery.
People say that harm reduction or giving out supplies to drug users, new, clean, sterile equipment, is enabling them to use drugs. And I disagree. I think it's enabling people to use safely and to reduce the amount of harm they're doing to themselves. And what's wrong with that? You know, enabling somebody to use drugs, sure, I could see that being wrong. But this is enabling people to be safer and reduce the chances of getting a disease, sometimes a lifelong disease, or a disease that can affect them forever. And if we can enable people to use safer, why not?
We provide clean, sterile equipment in order to reduce the health harms of those individuals who are using substances. Health harms could be an increase in bloodborne infections such as hepatitis C, HIV. Could also be like an increase in wounds, infections as well.
So regardless of the substance, we focus on the harms associated with them. Evidence shows that healthcare costs and disease transmission even are actually reduced through access to our needle exchange programs and other harm reduction programs.
And I think, I don't know statistics wise, but I think maybe that's why so many people of my generation are Hep C positive. I'm sure that played a role because we were sharing beer at the time, or like I said, trusting. Sometimes the person cleaning the needles maybe didn't know if they had cleaned them all properly. I just trusted that they were clean. So I think a lot of people my age, I'm 46, I think maybe a lot of people in my generation are Hep C positive because of that fact. And now that we have it, I tell younger people who use how it used to be and how fortunate they should be, or they should feel, because they have access to the equipment you need to use safely.
I have a 2-year-old daughter, and another one at the end of May is due, and I guess you never know what might happen in their lives. Anything could happen, anything hopefully good, but potentially not good. And I would still hope that regardless of that, whether Charlotte is Dr. Greg's daughter or not, that people show her the respect and compassion that she deserves as just a member of the community of Kenora. And I think that same respect should be shown to everybody else who is part of this, whether you like it or not, whether you find needles on the floor as an offensive thing, I think there's still an amount of respect that we can show to those individuals. And respect is not just about saying hi and shaking somebody's hand, but I think it's also trying to engage and understand why harm reduction strategies are being used and why they work as well. Because they do work. We're trying to help very difficult to access individuals who do not trust a healthcare service to get the healthcare that they need, that they deserve as members of this community and members of this country.